Welcome to Wycombe Dental Hub.
The truth is, nobody likes going to the dentist, but if you have to, you should go to a good one. And I think the Hub really is very good.
My name is Marcus and I'm a dentist. I run some of the busiest practices in the country. It all started here in Milton Keynes, but today we have practices in Cambridge, Peterborough, High Wycombe and Northampton. I now work as part of the group my mum and dad set up so many years ago here in Milton Keynes. This is a proper family business.
I've been a dentist for almost 40 years, and the one thing I realise is that you've got to meet the patient's needs, their expectations and their lifestyle. People do not want to wait, they want to be treated fairly, professionally and properly. We have a very large team of dentists here. Dentists, hygienists, therapists, dental nurses and receptionists.
My name is Sergio. I have a PhD in oral surgery from Istanbul University from 2007. I registered as a dentist here. I have a special interest in implantology, grafting, wisdom tooth extractions, impacted teeth and any kind of difficult extractions. An implant is basically a titanium rod. Threads all around so it can catch as much bone as possible when we're placing it. Let's talk about simple implant surgery. Numb the patient up, do a small cut on the gum, use a couple of drills, just vibration, no pain, and then we place the implant into the gap. We book the patient for an hour, but if it's simple, we don't need to use the whole hour. Then give a couple of stitches, dissolvable mostly, and then send the patient away, call back for a review in a week time. A little discomfort might be expected, but as I said before, it is surgery, so painkillers for a few days, and avoiding eating on that side for a few days and these kind of things. We have all the tools we need in here, and we have a nice team, and team means if we need any advice from any other dentist, we have all the other dentists with some experience in their field so we can discuss. Sometimes cases might get complicated, you might need to have another idea, or it might be what we call multidisciplinary, so other kind of dentists might be involved in the treatment, so we can come up with one solution which might be good for the patient, and if the patient agrees on that one, we can work as a team and come up with a nice solution.
Our patients know that they can rely on us. We offer state-of-the-art care 7 days a week, and we answer the phones 24/7. So no matter the problem a patient has, we will be there to help them.
These are patients who go to other dental practices but come to see us when their dentists are shut or their dentists are on holiday or just simply not available.
Because I had a bit of a problem that could be resolved by my other dentist, I phoned their 24-hour emergency hotline, and it was like 10 o'clock on a Friday night. And they dealt with it, they were very professional, they were there, they were open. And of course, when I found the place, I just thought, well, you know, yep, this is where I need to be coming.
My name is Bilal. I am a general dentist that focuses on emergencies and aesthetic dentistry. It's 7 days a week. An emergency can just come up anytime, and I get to see people and hopefully fix their problems on the day. And then I actually focus on aesthetics. You went for a jog, you've damaged your front tooth, we can make it look normal again. Or even if you just want to refresh your smile, brighten your smile, we do whitening, Invisalign, veneers. So the focusing is just on making things look nice and actually making you feel nice.
The fact that you can have a second opinion in-house is really, really important to patients.
I've been coming here for 8 years now, and initially David was my dentist, but I've also worked with some of the other dentists in here because I've had a couple of other problems. So this dentist is very good because they have dentists who've got specialist interests, which means that when another problem was found, I was referred to someone who dealt with that, which suited me fine.
We design all of our practices to make sure that they're friendly and welcoming, because we know how important that is to our patients.
The first thing I ask myself is this sort of person I want to have greeting patients and treating patients? Is this the sort of person that patients are going to warm to?
I think this is such a great practice. The range of treatments is phenomenal, and there's always time to have a chat. So I like that. You get a feeling of sort of like warmth. Yeah, warmth.
I think that almost every patient is anxious when they come to the dentist. I think even dentists themselves, when they go to the dentist, are anxious. And I think that's a perfectly normal and natural thing.
I've been coming here, since I was born. I've always been, when I've come here, felt at ease. They've always made me feel relaxed, always explained everything, and they're all really friendly people.
My name's Asim Khan. I'm a general dentist. I do all sorts of treatments, such as extractions, simple extractions, surgical extractions, dentures, all the sort of things that any patient would want to walk through the door and decide, look, what treatment do I need? And obviously we've got loads of specialists here as well, so for more specialised things, it's easy for us as general dentists to pass them on to the specialists and make use of those. I like to take my time when I'm dealing with patients, just to make sure that I get to know them, answer any sort of questions that they may have, because I want them to be able to feel as though that they can trust me. I think that's very important, that patients trust their dentist, that they're fully aware of everything that we're doing. And it might be simple things as just looking at the x-ray, talking through all the steps of the assessment and the treatment planning and the final treatment.
My name's Jazz. I'm one of the general dentists here at the Hub, and I've got advanced training in periodontics and oral surgery. So periodontic disease, also more commonly known as gum disease, is an inflammatory condition of the gums, which can have serious consequences if left untreated. My job is to diagnose and make sure that it's identified early as possible to provide specialised care and to prevent tooth loss. I like working at the Hub because of my colleagues. We're all friends here, and it allows me to collaborate with an extensively trained team who I can rely on 7 days a week. I don't have any hesitations in asking for their opinions and working with them closely to bring about the best patient care.
I'm Cordia. I practice dentistry for more than 20 years already. I graduated from the University of Hong Kong in the year 2000. And I get my first degree in Bachelor of Dental Surgery there. Afterwards, I took many courses like the diploma, advanced diploma, postgraduate diploma, because I have the interest in orthodontics. The kind of patient coming to see me are those who look for straightening their teeth or having a better smile. So most of them looking for orthodontic treatment or Invisalign treatment. Invisalign treatment, like they are removable appliance for orthodontics, clear aligners that are moving the teeth in sequence. So we plan it digitally. We use computer simulation, we use CleanCheck, we use everything to have the records from the patients, and then we plan all the teeth movement with our knowledge, with our technology to manufacture a series of clear aligners. The kind of patients that are suitable for Invisalign treatment are those who don't want braces, they don't want metal or wires in the mouth. People who need to work with people, talking to customers, they don't want to have more visible, the most visible braces in their mouth, and they want to have those clear aligners to straighten the teeth.
My name is Lorenzo. I'm a Spanish dentist. I moved to the UK 8 years ago. My practice is limited to endodontics and restorative dentistry, and my goal is to save and restore damaged teeth, always trying to obtain the best long-term results. I hold a master's degree in endodontics and restorative dentistry from the University of Valencia. I keep updated annually with lectures and courses to provide top quality care. I enjoy working at the Hub because we have a very talented team, a great atmosphere, and the latest technology. And this allows us to deliver very high quality treatments.
We offer sedation in the practice. We work with a sedationist. That's an outpatient procedure, so involves giving some medication in which changes their state of mind. And the good part of sedation, most of the patients do not tend to remember the procedure. They just need to bring someone in here because we cannot send them out. They're going to be able to walk on their own, but feeling a little drowsy, a little confused, but should be okay.
Cross-infection control is of paramount importance to the success and safety of every dental practice. It's not just about protecting the patient, it's actually about protecting the dentists themselves and also the whole clinical team. And actually, a practice that practices the highest levels of infection control is the sort of place where I personally would like to receive my treatment and where I would like my family to receive their treatment.
One of my jobs running the practice is of course to make patients happy and to make sure we're offering gold standard treatment, but it's also to attract the best dentists, and the best dentists want to work in state-of-the-art practices, and practices like ours.